Hey, it's Dr. Matt Bridges, double board certified facial plastic surgeon from Richmond, Virginia. I just wanted to do a quick video to talk about nasal obstruction. I see a lot of patients who want to improve the look of their nose with rhinoplasty. Now, even though we are focusing on the outside of the nose during rhinoplasty, a vital part of the clinical evaluation before surgery is assessment of the inside of the nose. Many patients have deviated septums and other issues with nasal airway obstruction, and these issues need to be evaluated and addressed during surgery. Not only do we want the nose to look better after surgery, we want it to function properly as well. Even if a patient does not have nasal obstruction before surgery, if we reduce the size of the nose, like reducing a hump, we could cause nasal obstruction if we aren't careful. When I perform rhinoplasty, I never leave behind a deviated septum or blocked nasal valves. In fact, the majority of rhinoplasty patients have some degree of septal deviation, and we always fix it during rhinoplasty surgery. With bias, I would say that being trained in ENT as well as facial plastic surgery is a critical advantage for rhinoplasty. Septoplasty can be a tricky surgery just like rhinoplasty, and if you don't have the training to perform septoplasty properly, you're asking for trouble with nasal breathing after surgery. Additionally, if the front end of the septum is deviated, this causes nostril asymmetry that needs to be dealt with during rhinoplasty. Here are a few examples of cases where the front end of the septum had to be repositioned to improve nostril symmetry. Also, straightening the nose externally almost always requires straightening of the septum inside the nose. If you want to learn more about rhinoplasty or septoplasty, or just have trouble breathing through your nose and you want me to figure out why that is, check us out at Facebook, Instagram, and TikTok at Matthew Bridges MD, or on the website at matthewbridgesmd.com. See you next time.